royal family, subsequently, all the women started delivering as a pride on the table. Secondly, it will say that after the French Revolution, a lot of women were delivering outside on the roads in France. It actually came from France. Table delivery has come from France. All women were delivering on the road after the World War, and then they were brought to the hospital. The hospitals had all those labor kits, and women started delivering on the labor. This is a preferred practice by obstetrician and not by midwives. Even today, when we see women being delivered by midwives, they have been given all the alternatives of delivery in various positions. And when we give option, when we offer them different options, women are preferring alternate, make it upright positions. Since last 2 years, I am practicing in my hospital, which I have shown to the workload. Almost 2,000 to 3,000 women have delivered in various alternate birthing positions. I will show you the several pictures, I will show you the videos. So this is the background, and then it was thought that why not change and go back to the upright position rather than the supine position. If we hear and read the recent advances to OBGYN also, it also shows that it is evidence-based practice that women should be given option and preferably they should be delivered in upright position rather than supine, where supine position is called as a gravity neutral position. It's a gravity neutral. You are not taking help of the gravity, and then you are asking her to push. And lot of problems, lot of interventions, episiotomies, forceps, venues, and maybe failure of descent, and all those problems resulting into increased C-section rate. So, accepting this physiology and the principle, I started with my own facility, and which is giving brilliant results. Now, this is the ancient birthing position. Many of the pictures, sculptures, paintings depict this. These are upright positions, these are sitting positions, these are squatting positions. Women were supported, which has been told earlier, and this was the ancient birthing positions. How it got shifted to table, that also I have told you. WHO recommendations 2018 for positive childbirth experience, working woman must be mobile, ambulatory, and should adopt upright position of her choice, with or without epidural analgesia during birthing process. This is recommendation number 25 and that's quote by WHO year 2018. Women still deliver. It's unfortunate that all over the world women are still being delivered. Urine health facility, lower to higher, in a supine position. Why is the reason? People are not aware. They do not have knowledge. And of course, if we talk about the alternate birthing position, there needs to be some training. Otherwise, without training, we all obstetricians have been trained to deliver women on table. None of us have been told, trained, how to deliver a woman in a chair, how to deliver a woman using any alternate birthing position. So this is the lack of training, lack of adequate space in the labor. Women have to be ambulatory. We all know in the medical colleges, teaching institutions, what is the situation of the labor. There has to be adequate space. Non-availability of birthing tools, which are showing. Prevalent modern, so-called modern delivery practices on labor table. These are the reasons why women are still delivering in a supine position. Now, what are those birthing tools? They are birth ball, also called exercise ball, or a Swiss ball, or a fitness ball, which we will be showing you. Another is called a peanut ball. There is something called rebozo, which is a long flat garment used to maintain upright position, which we are using. Comfortable upright birth support, that is called cup, CUB. Grab bar, birthing stools, which all we are using. I will show the pictures. Now this is a birthing ball, which we have also got from our place just for demonstration, and peanut ball. This is how the women are using that. That also will be demonstrated. This is called comfortable upright birth support stool, cup. Use of the cup. This is a birth stool. We will show you this third one, pink one. We have brought it to show you how the women are being delivered. This is called a squat bar. Attached to the foot end of the labor table, which I have got attached to my labor room. And women are holding that bar. They are upright, sitting, squatting, holding the bar and pushing at the second stage. That is reducing the second stage of labor. Another very important thing. are doing this, what is called as a hands-off technique. We are not touching, we are not giving that all age-old technique support. We are just observing baby. Give time, be patient, let the restitution take its own time, and then only after the head comes out, just be careful, be cautious that baby sometimes suddenly comes out. We have to be careful in holding the baby so that there is no fall. So all that is happening. I will show you the pictures. Rebozo, what is called, it's a sort of we have modified it in the form of a rope, which is there. This is a picture from my own labor room. This is a grab bar, so that she can just hold. She wants to, woman usually wants to hold something, so that she can push a little bit. This is the birthing chair. So the original birthing chair, wooden chair, which got broken after around 150, 170 deliveries. Now I have got a steel chair. Now this is a Rebozo used while using birthing ball. Women are sitting on a birthing ball. Our midwives will demonstrate this, how it is to be done. Use of a birthing ball for pain relief. That also gives a lot of pain relief. Massaging can also be done. Here the sister is giving a shoulder massage to this woman who is in labor. This is a peanut ball, how to use it. The woman is there, she is a labor companion. This is another similar picture. Now this is the squat ball, which I just explained. This is the foot end of the bed. And the resident is conducting the delivery. Woman is sitting or maybe semi-recumbent and then holding either directly to the bar or there is another small rope. She is holding it and then trying to push it. What are the benefits of all these birthing tools? Tools help women to cope up with the pain and discomfort of labor, especially the balls. Birthing balls, peanut ball, if they are sitting on the comfortable soft balls, there is a lot of relief and she feels pain relief. It helps in descent of the baby in birth canal and helps in widening of the birth canal, especially when she is upright. Tools are simple, low cost and effective. Tools help women to have a positive birthing experience and improve maternal satisfaction. They facilitate gravity and play an important role in the birth process. So these are the benefits of a birthing tools. Furthermore, birthing tools shorten the process of labor, reduce the chance of development of abnormal heart rate patterns, and most important, when we are saying that we is a hands-off technique, we are not touching the woman, not bearing down, not asking her to bear down against the gravity. There is reduction of episiotomy rate. Maybe before I started this particular, the episiotomy rate in my labor room was 87%, primary plus multi combined. Now it has been brought down to 42%. Maybe in the primings and multi with previous C-section. So this much reduction in the episiotomy rate has been happened since we started using alternate birthing positions and tools. Now, this cannot happen all of a sudden. We cannot expose our women to labor with all these birthing tools. There is need of birth preparedness. Women must be told about all these gadgets because there are new gadgets which we have introduced, not in the midwifery setup. Midwives are using it throughout. There is a long history that these gadgets are being used. So we conduct antenatal birth preparedness classes. We also take help of physiotherapists, which is a college in our hospital. They also come and they also conduct about the physiotherapy or maybe some exercises to the pregnant women. And there are fixed days on which these classes are being conducted. Birth preparedness classes, they are being conducted. Women are asked to conduct or how they should go home. They are also being told. Now, recently we have started giving information about various birthing positions using the chart. On one chart, all the birthing positions have been put, which I will show you, and the women are asked advantages of each and every birthing position. This is the chart, and accordingly, in brief, we tell that these are the options, which one you would like to have. Accordingly, that is noted. Again, in labor, when they come, again we tell them that this was your choice. Again, whether you want to stick to that or you want to go ahead with some other position. What is most important, all this is there is something called fear, tension, pain cycle. We as obstetricians have totally ignored about this. What is this childbirth fear, tension, pain cycle? It is said that because of the pain women get, labor, normal physiological pains, they develop a fear. The more fearful a woman, the more she constricts her blood vessels. That raises the tension. The less oxygen for the muscles of the more tense she is and the more painful contractions are, and that further, if the tension is increased, there is a hypoxia to the our uterine musculature that further causes pain. So this is what goes on: fear, tension, pain, fear, tension, pain, and we need to break the cycle by what is called as hypnobirthing. This is another new concept of hypnobirthing that helps in raising the confidence of the woman. We just tell them that this is physiological. You have to tolerate. There is nothing. This is the way the birth preparedness has to be there. So once she is mentally prepared, then that confidence builds up. She relaxes. Once she relaxes, she feels comfortable. So that particular fear, tension, pain is replaced by comfort, confidence, relaxation. So all that is being replaced. Now there is one more concept is called as positive affirmations. Woman must be told, she must be told about something positive, good, build her confidence. She should be told that you always keep thinking that everything is going to be good, normal, not to worry about, and these are the words which you should think about herself, that I am safe. With each wave, my body brings my baby close to me. I breathe baby down. Birth is safe for me and my baby. I will do what is best for the baby and my. So that is positive affirmation. She has to think positive. So that it is to be told that what you should think. All those things are told during birthing classes, and once she is with those mindset, she will definitely cooperate with addition to our efforts of bringing her pain down. Coming to alternate birthing positions and practices at our institute, which I am saying since maternal birthing position is the term. Childbirth position refers to the physical posture the pregnant mother may assume during the process of childbirth. It's called as a birthing position. They may also be referred to as delivery position of labor or labor position. Since traditionally women are being given lithotomy position or a supine position, that is, she is lying on her back with feet pulled. Still commonly used by many obstetricians, other positions are successfully used by midwives and traditional birth attendants around the world. Labor among primitive people states that they frequently use squatting, standing, kneeling, and all four positions. These are called upright birth positions. What is the situation in the present labor rooms, especially in a very busy labor room? There is lack of privacy. I am not talking about the private setup where a lot of privacy is being given to the patient, woman. The treatment has become the birth environment is such, there is lack of physical and emotional support by birth companions of their choice, not allowed to follow